Welcome to the SUNY Child Protection Policies Training. This is Module 2, which will cover defining and recognizing child abuse and the reporting threshold. Defining and recognizing child abuse. Before we discuss SUNY's policies in detail, let's take a step back to define child sexual abuse and child physical abuse and what it means within the context of SUNY's policies. The definition of physical abuse from the SUNY Child Protection Policy is as follows: physical contact with a child by a covered person which is intended to cause or causes pain, physical injury, including punching, beating, shaking, throwing, kicking, biting and burning, or directing a child outside of the norm of the supervised activity to perform physical activity which is intended to cause physical injury. The following are some indicators of physical abuse of children. Frequent injuries of any kind, including bruises, cuts, or burns, especially if the child is unable to provide an adequate explanation of the cause. Injuries may appear in distinctive patterns, such as grab marks, human bite marks, cigarette burns, or impressions of other instruments. Human bites compress flesh, causing bruises, whereas animal bites normally tear the flesh. Injuries to both sides of the head or body could also indicate physical abuse because accidental injuries typically affect only one side of the body. Additional indicators of physical abuse of children include injuries to the nose, which could cause bleeding, swelling, or deviation of the bone. Injuries to the mouth, which could cause bleeding, swelling, loose or missing teeth, or bruises from a gag. Injuries to the eyes, which could cause visible hemorrhages. Injuries to the ears could cause bleeding, visible twisting injuries to the earlobe, and bruises. Injuries to the head, which might be visible as bald patches caused by hair pulling, paralysis of facial muscles, and bruises on the face. Injuries to the abdomen, which may cause vomiting. Injuries to the skin may also indicate physical abuse. These may be seen as lacerations, bruises, welts resembling the shape of an instrument, such as strap marks, belt buckles, looped cords, or electrical cords. Further indicators of physical abuse are the presence of multiple skin injuries in various stages of healing, such as the presence of multiple old and new bruises, choke marks on the neck, rope burns or blisters, especially around the wrists or ankles, and bruises on the back of the legs. Burns may also indicate physical abuse. These might include burns in geometric shapes, contact burns involving both palms, burns or blisters on the back of the hands, immersion burns that are sock-like or glove-like, cigarette burns, burns on areas typically protected by clothing, and blistering from chemical burns. Skeletal injuries without fractures may also indicate physical abuse. Such injuries may be observed as tenderness at the joints from pulling, jerking, or dislocation, and tenderness in the ribs. There also exist certain behavioral indicators of the physical abuse of children. These may include destructive, aggressive, or disruptive behavior, aggression toward peers or siblings, apprehension when other children cry, and destruction of property and vandalism. Other behavioral indicators may be passive, withdrawn, or emotionless behavior, such as shying away from touch, flinching at sudden movements, or being wary of adults. Physical abuse may also be indicated by behavioral extremes, such as aggression or withdrawal. Physically abused children may fear going home. They may fear their parents or caregivers. They may seek affection from any adult or wear long-sleeve clothing or similar clothing to hide an injury. The SUNY Child Protection Policy defines child sexual abuse as follows: engaging in a sexual offense with a child and/or encouraging or promoting sexual performance by a child. Pursuant to the New York State Penal Law Articles 130, 260.263 and Sections 260.10 and 260.25, sexual offenses include sexual misconduct, rape, criminal sex acts, forcible touching, persistent sexual abuse, aggravated sexual abuse, course of sexual conduct against a child, facilitating a sex offense with a controlled substance, sexually motivated felony, predatory sexual assault against a child, and sexual performance by a child. This also includes penal law offenses relating to children, including endangering the welfare of a child and unlawfully dealing with a child in the first degree. Sexual performance by a child, as defined by the penal law, is any behavior which results in touching of the sexual or other intimate parts of a child for the purpose of sexual gratification of the child and or adult, including touching by the child and or adult, with or without clothing, and all acts defined by the New York State Penal Law, Articles 130, 263, and Section 260.10. Physical indicators of sexual abuse may include the following: injury to the genital area, which may cause pain or itching, difficulty walking or sitting, and bruises or bleeding in the external genitalia. The symptoms of sexually transmitted diseases could also be an indication of sexual abuse, including oral venereal infections. Torn, stained, or bloody underclothing may indicate sexual abuse, as may pregnancy, especially in the early adolescent years. Behavioral indicators of sexual abuse include the following: unwillingness to change clothing for athletic or physical activities, infantile behavior, and behaviors indicating withdrawal or fantasy, sexually suggestive, inappropriate, promiscuous, or seductive behaviors or verbalizations, poor peer relationships, age-inappropriate knowledge of sexual relations, sexual victimization of other children, exaggerated fear of closeness or physical contact, and self-injurious behavior. Under the Child Protection Policy, if you have a reasonable cause to suspect child sexual or physical abuse, you must report. Reasonable cause to suspect means that based on your rational observations and experience, you have a suspicion that a child is being physically or sexually abused. Reasonable cause to suspect means you have a logical basis to suspect. You do not need definitive proof or certainty. Reasonable cause can arise from your doubt or distrust of a child's explanation for injuries. Report each instance of physical or sexual abuse that you have reasonable cause to suspect. The Child Protection Policy prohibits retaliatory action against anyone acting in good faith who has reported alleged physical abuse or sexual abuse in accordance with the policy, or who is involved in investigating or responding to the allegations of physical or sexual abuse. Report whenever you have reasonable cause to suspect physical or sexual abuse of a child. Silence is not golden. The policy prohibits retaliatory employment actions that affect salary, promotion, job duties, work schedules, and locations. It prohibits retaliatory actions negatively impacting a student's academic record or progress, and it prohibits any retaliatory action affecting the campus environment, including harassment and intimidation. This concludes Module 2.